My name is Marvin Christie. I really appreciate all of you being here. This is Keeley Marsh, and this came out of a simple conversation. We were at an event where Mayor Keeley was there, and I kind of put him on the spot, asking him some questions, and he was very receptive, and it started a dialogue, and Kaylin asked him some questions, and they were harder questions, and he said, why don't you talk to Manu about that? And so he brought Manu into the conversation. It was out of his district. So anyway, I'm a Santa Cruz native. I enjoyed growing up visiting my dad in his office downtown where he was since 1971. I now own a business downtown. I spend a lot of time down there. I have 2 children. My boys go downtown. And there's some things in our community that are less than ideal. We're hoping that this conversation is beginning of a bigger movement and an organization where we have all these great panelists who have agreed to join us, and they all have different expertise, and together I think we're going to have a neat group here. So let's see. Let's let Kaylin introduce herself.
Yeah, so you did a great job. So I'm Keeley Marsh. I'm also a resident here in Santa Cruz. I live in Live Oak. Manu is my supervisor. And yeah, so we started a conversation. Jessica Soto also was involved in that conversation, was really integral in making this happen. And you know, from our perspective, we were upset and we were angry about some of the things that we were seeing. And then after having conversations with many of these people, we realized that this is a really dynamic and complex issue. So our goal here today is to kind of unpack a little bit more of that, find out where the gaps are, and let's make this better. So what we should do now is maybe do some introductions. If you all would like to just maybe say who you are, your position in the county, just to familiarize everyone who may not know you. Danny, do you want to get started?
I'll go first. So my name is Danny Contreras. I'm the health service manager of the MAT, Medication Assisted Treatment Program, at all the county clinics. So that's HPHP, MLI, and Watsonville Health Center. So I just manage that program, not the actual clinics. In 2016, we started the program. And real quick overview, it was just me as the first drug and alcohol counselor and 1 doctor. And we quickly went from 1 doctor and me to over 30 doctors providing this service. And I have a team now of about 10 drug and alcohol counselors, nurses, medical staff, and everything. That we also go out to the mobile clinic, and the street medicine team goes out to homeless encampments and start working with patients where they're at to get them treatment, get them their health care, get them their mental health. So that's what I do. Thank you.
Do you guys mind standing up for the people?
I'm happy to stand up as well. I'm Manu, Koenig, 1st District County Supervisor. For those of you who don't know, the 1st District is really the district right in the middle of the county. It includes Live Oak, where we are now, SoCal, and up Old San Jose Road all the way to the summit, as well as parts of the city in Prospect Heights.
Thank you.
Good evening. My name is Bernie Escalante, and I'm the Chief of Police for the City of Santa Cruz.
Hi everyone, my name is Robert Ratner. I'm the Director of the Housing for Health Division in the County of Santa Cruz Human Services Department. Glad to be here. Look forward to the conversation. Thank you.
Justin Cummings, 3rd District County Supervisor, also former Mayor of the City of Santa Cruz. And my district is the majority of the City of Santa Cruz, Bonnie Doon, Davenport, Swanton, North Coast, all the way up to White House Canyon. So most of the North Coast as you leave the City of Santa Cruz, that's my district.
My name is Nick Baldridge. I'm a lieutenant with the Sheriff's Office. I oversee our community policing unit, so I have all the different substations and the sergeants that work throughout the county and all the different areas of county. I also run our school resource officer program and our alcohol and tobacco compliance unit.
I'm Lisa Murphy. I'm the Deputy City Manager for the City of Santa Cruz, and I oversee the Homeless Response Division, the newest division in our city. I also am a lifelong resident of this county and have a vested interest in what happens here as well.
Hi, I'm Phil Kramer. I'm the CEO of Housing Matters. We're a local nonprofit working on solutions to homelessness. We do everything from outreach to emergency shelter, provide supportive services throughout the county. We're building supportive housing. We're about 220 people in shelter on our campus, and we support about 250 households throughout the community, throughout the county.
So I'm going to get started, and I'll ask a few of you panelists, but if any of you would like to chime in about any of these questions, please feel free to do so. So this first one is referencing the point-in-time statistics. These are statistics that represent questions that were asked of the unhoused and their personal answers. So the point-in-time statistics had much information surrounding the unhoused, and at times it seemed a little bit conflicting. For example, 37% of those surveyed cited eviction as the primary condition that led to homelessness, and only 9% thought the primary condition was drug or alcohol abuse. But at the same time, 67% self-reported that they conduct in drug or alcohol abuse. Now, while only 8% responded that illness or a medical problem had led to being unhoused, 49% had self-reported a chronic health condition, 57% a physical disability, 39% a psychiatric or emotional condition, 35% PTSD, and the list goes on. There appears to be a disconnect between what drives and what keeps people in homelessness. What are your thoughts on what drives and keeps people in being unhoused? And I have a few here: Phil Kramer, Lisa Murphy, Robert Ratner, and Danny Contreras, that I'd like to answer this. Lisa, would you?
Sure. I think, well, by those numbers, you can see it's a really complex issue. And there's a lot of drivers. And I don't think that it's a one-size-fits-all description either. You know, there's also domestic violence. But I do think it's not only domestic violence, it's job loss, which should be included in there. Mental health and addiction, huge. I think that's a driver, and what keeps people out is their inability even to get the services they need so they can then get into housing. And then, of course, the lack of affordable housing. I think you're going to hear that from us up and down this panel, that the housing is huge. So I'll let others jump in because I know our time is quick. But I think that's a driver, and I also think it keeps people out. And there's also, I think, some we'll talk about policy changes that also limit people's abilities to get into housing as well.
Great. Phil Kramer, did you want to speak?
Yeah, sure. You know, there's a lot to parse in the pit count, and just looking at the data can be really difficult. I think looking at trends in the pit count can be helpful, actually, to see how it's changed over time. We just look at the 2019 pit count and the 2022 pit count. The change in people experiencing homelessness with disabling conditions went from 39% to 67%. So people with existing medical conditions, if they're living unhoused in the community, those existing conditions are going to worsen over time. And I think we're seeing that, right? We're seeing people that are unhoused for longer periods of time because we don't have enough housing in the community. So I just came back from a housing conference in San Diego, 2.5-day conference, 2,000 people there. For years, the conference was really focused on housing production and legislation, and this conference was homelessness and supportive housing was part of every track, every workshop. And this one doctor said something that's really powerful, and she said there's no medicine more powerful than housing. And that really starts with housing as the foundation. So health, wellness, well-being, and community integration starts with housing. So again, I think to Lisa's point, across the panel, we'll hear that. So what does a solution look like? You know, on any given day, between 2,000 and 3,000 people are experiencing homelessness in our community. Between 2,000 and 3,000, and that's probably an undercount. And on a good day, when all shelter beds are open, there's between 500 and 600 shelter beds. We are going to see people living unhoused in the community, right? With that much of a disparity. And the reality of living unhoused in the community is you're living your life in public. Right? Most of us, I can go home, I'm having my breakdown, my whatever, my moment, my glass of wine in private. I'm going to the bathroom in private, and shower in private. People that are unhoused are living their life in public. They have no other place to be, unhoused and unsheltered, right? So again, for some of our folks, they're in shelter. So I think taking up more time, just drawing our attention to the fact that many couple thousand people are living unhoused in the community. They're living their life in public. They don't have the benefit of living their life in the privacy of their homes like I would imagine most or all of us.
Thank you. Robert Ratner.
Yeah, oh, I could talk for a long time on this topic. So I'm going to say a couple things about the PIT count. So PIT stands for point in time count, and it's a survey that's done typically every 2 years. We're now trying to do it every year, but it's 1 day. So if you think about the implications of doing a study on just 1 day versus looking at it over the course of the year, you're going to have some bias in the data. And what doing a survey on 1 day shows you is who are the people you're most likely to catch on a single day. The people you're most likely to catch on a single day are the people who have long histories on the street, multiple barriers and challenges to getting back into an environment when there's not enough affordable places, not enough residential treatment. So I think it's really critical we all keep that in mind. Another part that I wanted to talk about is if you look at the data, there's a data system called the Homeless Management Information System that's mandated by the federal government. If you look at the data in Santa Cruz County about the percentages of people with behavioral health issues who are accessing programs, it's only about a quarter of the people. So it's very different from the PIT count over the course of a year. And if you look at the number of people who have a substance use challenge that they're reporting that in the survey, it's also only around 13%. And if you know how many people in the US on a given day are struggling with a mental health problem, about 20 to 25% of people are struggling with a mental health problem. And with the substance use disorder, you see between 5 and 10%. One of the real challenges I think on this issue is we have a lot of stigma around mental health and substance use issues. And instead of focusing on, we're going to talk more about probably, affordable housing in places where people can sleep, we focus on health conditions that we believe are a sign of a moral failure. And I think as a society, in the US, around the globe, we really need to understand that mental health and substance use issues are health conditions. And as we start to treat people and those things as health issues, we're going to make some progress in supporting folks who are struggling to get into housing. There's a book out called Homelessness is a Housing Problem, and we have a lot of chairs in the room, and one of the metaphors of this idea is that there aren't enough places for people to sleep that they can afford. The people that end up on the street are the ones who have the most barriers to being in community with others or being welcomed into space. So the disparities we see in who ends up being homelessness is because we don't have enough chairs where people can come in and sleep and be supported. The people we see on the streets are the ones where there's lots of stigma and disparity, and that's what contributes to the statistics. And I think that's part of why when you ask people why they're homeless, they talk about the housing, the loss of jobs, loss of housing, landlords raising the rent. And the other issues, the health issues, often come when you're on the street, not before. So we often forget correlation, we mix up correlation and causation. Which came first? And as Phil was saying, if you're sleeping in a tent, how many of you have had trouble sleeping? Right? So you're different the next day. And so imagine trying to sleep outside with all the stressors about sleeping outside. There's a lot of evidence that if you have trouble sleeping, that will increase the likelihood of a behavioral health challenge. So I could go on, and I'm going to stop. Thank you. I will continue later.
Thank you. Danny, did you want to contribute?
Sure, why not? I mean, I think they all hit everything. There's so much stuff. It's a multifaceted thing, right? And I think that PIT, right, point in count, that's just a snapshot, right? That's just whoever we can get. There's people up in the mountains, in Pocono, and all those places that don't even come down sometimes, and you don't know that data, you know. I think substance abuse is huge, right? I know it's not probably it didn't show in that data, but there's substance abuse. People are stigmatized, like he was saying, and they sometimes can't get the help that they need. Sometimes they go to places and they're turned away, right? I used to work at the shelter, and now it's called Housing Matters, and I used to manage the program there, and I used to be a case manager there and housing people. You know, sometimes some people because of their mental health. You know, there was I'll give an example. There was this lady that I worked with there, and she would not trust me for no matter what. I just needed her to sign some papers so I get her a Section 8 voucher and get her housed. But because of her mental health, she wouldn't. She would literally pull her pants down in front of me, pee, cuss me out, tell me all kinds of crazy stuff. But we had a plan. We had a plan that, even though wasn't the best plan, but it was the plan that we could do. When she decompensated and we got her to the hospital, they got her on her psych meds that she was supposed to be on. Then she went and sat at the El Dorado house and got, stable. Because I guess my chance to go see her. I went and see her. hey, just need you to sign these papers and I'm gonna get you housed, you know? And she's apologizing to me. We took care of all the little details that we needed to take care of, and she's been housed. I get a Christmas card from her every year of what, you know, just thankful for what we did when we were at the shelter, you know? The other thing is, you know, sometimes there's a lot of stigma with that policing. I see it at the clinics when I started. You know, there's a way to talk to somebody. I can talk to somebody like they're my equal, or I can talk to somebody like that, right? And if I'm talking in a certain way, or my behavior or my body language is showing like I don't value you as a human being, you're trash, you're a drug addict, you're homeless, people can feel and sense that, and they don't want to get the help, right? If you're doing that, right? I remember when I was at the shelter, we had security. I don't know how it is now all the way, but
Still have security.
okay. Well, there was security, and they probably didn't have the best training, and I was always going out there to try to kind of figure a situation out. This person was getting cussed out. I'm like, well, why are they cussing you out? Let me pull you away because you're getting kind of crazy with this patient or client. And let me talk to the client and say, what happened? Man, it's freaking cold outside, it's raining, and my socks and shoes are wet. I'm just asking for some donations, and this person thinks I'm doing something else. I'm not. That's all I need, some socks. They were going to get banned from the homeless shelter of their essential services that they need for 30 days because they couldn't communicate right. And we had to figure out a way, okay, cool, let me pull this person away from this situation. Let me de-escalate this person, talk to them later. Let me figure out with this client and then get them what they need. And so this person didn't get a 30-day ban from the shelter, which would have been worse than being out in the streets with no food, no bathroom, no nothing, just wherever they can go, you know? So there's stuff like that. There's stuff when people show up in the clinic, which I feel like we have grown by leaps and bounds within culture and shifting culture in our clinics across the whole entire county. You know, people can see it. Like, you're looking at me like I'm a drug addict. You don't want to help me out. You know, if I'm talking to you like that, people get cussed out. You're gonna get a reaction that you don't need to get when you just talk to somebody as a human being, right? I've tried to make it with my team and everywhere else, and we're even doing some other training still right now. It's called AVP, Alternative Violence Program, where you get a very diverse groups and you put them together, patients, staff, and all that stuff. So people can connect on a human level, right? It's really important that people connect and know that they're valuable, right? I like this term. I probably talked too much. I like this term. I can go forever. Unconditional significance, right? It doesn't matter what you've done, what you've been through. Like, you have potential and unconditional significance as a human being.
Yeah.
The next question is, what current policies and planned policy changes surrounding mental health, addiction, and unhoused community safety? What are the current policies and planned changes to policies? And what other policies are needed to address these issues? And Mayor Keeley, do you mind starting that question? Or welcome, and sorry we didn't get your introduction, but
sorry I was
Mayor
late.
Keeley is here.
It's not your fault. My fault.
We're grateful to have you. So just about any current policies, planned policies, and then the policies that maybe aren't planned but should be.
Current policies, I think it's important to distinguish between the city and the county. I do that every time I speak to this issue because we are not the same. The county is not a small version or a large version of the city, and the city is not a small version of the county. God created counties to provide health and human services. That's what they do. They stand in the shoes of the state and federal government to deliver services to all kinds of folks in need, including those members of our community who are living outside. Cities are municipal corporations. You can wander around City Hall all day. You won't find a Department of Health, a Department of Mental Health, or anything of the sort. You'll find a planning department, public works, and parks and recreation. That's the kind of thing we do as cities. In the homeless space, what we do, I think, is we do some work in the homeless space of what I would call a social service nature. It's not an absolutely bright line. So we do some work, as Mr. Yamwali and his team do inside the city. But by and large, that's not what we're very good at. Cities aren't very good at that because they're not organized to do that. So, policies. I think that going forward, what the city can do that will make a real difference is that the city does the brick and mortar side of what this need is. In other words, the city can be the entity that leads on, in the city of Santa Cruz, on shelter, navigation center, permanent supportive housing. If we do that in sufficient quantity, for example, in concert with Housing Matters at the Coral Street site, what is it we can do that builds the brick and mortar side? Because the state of California, which is the sort of the parent company, if you will, of the county of Santa Cruz, they're not ready at this point to provide that kind of brick and mortar support. They are much more over on the side of providing the health and human services that are poured into the facility side. So I think the change that I hope the city engages in, and I see some of my colleagues here, we are in robust conversations about this, is to see if we can fashion a bond in 2024 for the ballot inside the city of Santa Cruz to provide the brick and mortar side of homeless, and to provide another part of the bond. Think of it as a barbell. The other barbell would be over on the affordable housing side. But I think that's the big moves in terms of the city.
Great. Thank you. So again, these are policies, current policies, future policies, and what policies are needed. Chief, do you mind? Yeah. Did you have anything on that? And you can keep it short.
Yeah, it's a little bit outside of law enforcement's lane, I think, but I mean, there's a lot to talk about policies and legislation and the decriminalization of drugs, the deinstitutionalization of mentally ill. There's a lot of stuff that's going on that has happened and will continue to happen that I think is important for you to pay attention to. I can say within the city, the police department, the fire department, along with the city manager's office, we're working currently on a program that's similar to a CAHOOTS model to bring into the city. It's a non-law enforcement response to mental health conditions, substance abuse situation, homelessness sort of situations, instead of calling fire, police, or EMT. I think that's a positive thing. And the other thing that we do have currently, as far as within our organization, is we have mental health liaisons, and I know the sheriff's office does as well. So does Watsonville. We have 2 mental health liaisons that respond either with us or by themselves to subjects that are in crisis. And so that has been extremely helpful and I think powerful in getting people hopefully in a better path and getting them some help in the middle of a crisis. So.
Okay, great, thank you. Officer Baldridge, would you care to add to that? As you guys.
Yeah, I can make it quick. Yeah, we have the mental health liaisons, which we're working on trying to expand that as much as we can. In addition, we have the focused intervention team, and what that is, it's a unit that it works throughout the entire county. So these are individuals that are within city limits, within the county limit, within the unincorporated area. And this team, what they do is they have a list of folks that normally it's either substance use or mental health issues, and that are causing problems within the community. And what they do is they have pretty much a weekly check-in. They go and find folks. They have these check-ins with them. They try and get them resources, connect them up with family members, try and find ways to get them out of the environment that they're in, where they're being disruptive to the community, and move them to a more stable environment.
Great, thank you. Dustin, would you like to speak? That'd be excellent. Thank you.
Yeah, so following up on what Mayor Keeley said, the county, we get a lot of the state and federal funding for programs that help people who are people who are experiencing poverty, period, housed or unhoused. So with a lot of these teams that are going out, they're trying to get people connected to CalFresh. They're trying to get people connected to MedCal so they can access medical services and have access to food. But it's really challenging when people don't have stable places to be. And so, if somebody one night is, the city opens up the Civic Center as a warming center, and then it closes it and opens up, Depot Park and it closes that, people don't have that stability of where they can count on going. So that's why we oftentimes find people going out into the woods, because at least they can create a community and they know that that's where their stuff is, that's where they can go every night. So if they do need to go to, to go to medical services at the MLI campus, or if they need to go to alcohol treatment, they know that they can go back to that place, and that place is where their stuff is going to be. So, having more locations where we can have more homeless services, I think is really critical. And one of the things that we ran into in the city and the county is nobody wants to buy their house. And that's a big issue for us, because we can't, like, if these people don't have a place to go, then there's nothing we can do. And I know that Supervisor Koenig experienced this, where he's been trying to open up a facility in his district and people got really mad about it. But I think what people, and it comes back to this whole conversation of how we perceive homeless people, when you start getting people the stability, they're able to recuperate themselves. And I think that if you were to go around to the different facilities that we have in town, most oftentimes, if you go to the Armory, we opened the Armory up, and I helped with that in 2020. We haven't really gotten any complaints. 1220 River Street was open next to the Tannery, and when it shut down and the Ross camp opened up, they begged us to reopen that camp. So I think it's really important that we start looking at models that work and showing the community what works and trying to work with them so that we can have more places for people to go, we can mitigate the impacts, but we can start moving forward in that way. And the last thing I'll say on this is that, when it comes to housing in our community, the housing escalation has to stop, and we have to figure out something to do. We're not gonna build our way out of this problem. And when I have friends who are like, I bought my house 4 years ago and it's doubled in price, the biggest issue to addressing this is the fact that people who work here, or people who provide those services, can't afford to live here. And when I had a friend a couple weeks ago who got 180% rent increase from $1,000 a month to $2,800, she told them no. She's now having to fight them, and the way our system works is that it's her responsibility to find a lawyer. Well, if you're, a county service employee, you're not going to have the money to afford a lawyer. And so we're losing teachers, we're losing the people who can provide these kinds of services, and so we have to figure out how we can stabilize our housing market so the people who provide these services can live here, and so we don't have more people going into homelessness.
Oh, sorry, Lisa and
So the question was sort of past policy, current policy, future policy. So I think the first thing I would stress is that the crisis that we see on our streets today has been building for a long time. And we're finally reached this point where it's just an all-out crisis. We all are faced with it almost every day. And I think we would all agree it's completely unacceptable. Fundamentally, the biggest piece of it is the housing piece. You heard Dr. Ratner talk about people lose their housing every day, whether it's from a domestic dispute or a roommate dispute, or they lose their job, or any number of other reasons. But they become homeless for longer in communities where there's not rentals available. And Santa Cruz is right up there at the top of the list as one of the most unaffordable places in the whole country with the lowest vacancy rates. So people become homeless and they can't get rehoused easily. So that's the volume problem, right? And in fact, one of the largest groups of people that we're seeing enter homelessness today are seniors. Seniors who cannot keep up with inflation on fixed incomes and are losing their homes. So that's the volume problem. Then there's sort of the, extremity problem, or the issue that we're seeing with mental health and addiction that has been cited here tonight. And then there's theft. There's a lot of pieces that have layered on over the last decades that make our law enforcement officers' job a lot harder. So whether it's first of all, back in 2000, we got rid of a lot of the mental health institutions, right? We said, hey, we don't want to institutionalize people. It's not a kind way to treat people with mental illness. And so we got rid of a lot of them. Then we took a lot of people with mental illness and we put them in prison. Then in 2011, the Supreme Court said, hey, California, you guys have a serious problem. You got too many people in your prisons, and you're not providing sufficient mental health or other health services. You've got to reduce this population by 30,000 people. So we had AB 109, which said, okay, we're going to realign the prison population. We're going to keep more people close to where their offenses were committed, close to their communities in local county jails. County jails were not built to hold people for long periods of time. They're built for really a 30-day stay, maybe a 1-year stay, if at the most. Now people are there for 5 years, 7 years, 9 years, I think maybe is the longest now. And as a result, we don't have the capacity in our jails to hold people even for short amounts of time for misdemeanors. Then you have other things like Prop 47 and 57, which 47 made it so that if you steal anything less than $950 in stuff, it's not a felony, it's a misdemeanor. So these problems have been building, right? And again, we're starting to take action on it. One last fundamental problem is we're sort of treating homelessness as a new problem. So whereas we have consistent and common funding from our federal government and state government to deal with things like child protective services, we don't for homelessness. Our county today has over 40 different grants that we're managing to pay for homeless services. I think it's 40, 41, 43, something like that. Those grants are not all the same. Some are 1 year, some are 3 years. We don't know if we're going to get them in the next period. And so our funding for homelessness is constantly fluctuating. It makes it really difficult to manage. We're constantly reporting. First of all, we're constantly applying for grants. Then we're constantly reporting to say that we're fulfilling the requirements of the grants. Those grants don't provide us a whole lot of flexibility. They don't allow us to say, oh, what's the best way to spend our money here on the ground? It's, you have to do this, right? That's dictated by someone in Sacramento or in Washington, D.C. It makes it really hard. So what's changing? First of all, we're really starting to get more organized and dedicated to this issue. And Dr. Ratner is the chief example of that. He was brought on just a couple of years ago as for the first time the county has a dedicated person to deal with the homelessness issue. And we created a division within Human Services, the Housing for Health Division. Dr. Ratner has brought considerable experience from the Bay Area and has helped really to improve the organization of our local homeless services, whether it's the reorganizing the management for the Continuum of Care entity, which manages a lot of those different grant and funding streams, whether it's reforming our homeless management information system, whereby all the organizations that are involved in this issue are reporting who they're working with and sharing that data back with the county so that we know who is homeless in the community and why and how we can help them best next. To organizing the new grant applications, such as the ones for Home Key. Right? In the first round of Home Key, our county got zero. We got nothing. We didn't apply for anything. We didn't get anything. In the second round, we got 3 Home Key grant applications from the state. It's going to build 63 new beds for people experiencing homelessness in our community. The money that we saw in the surplus for our state budget last year, we are getting that. It is coming into our community and it is helping to fix this problem. You haven't quite seen the results yet, right? Budget surplus was last year, we win the awards. Now we're starting to build stuff. I mean, as Phil said, he's got 120 units of permanent supportive housing going up. The city got $14 million to acquire the site next to the Housing Matters campus. They're going to be able to expand. I think with hopefully a little more funding, actually be able to build a navigation center there. Like I said, they've got the 63 units in the county. We'll be submitting more Home Key grant applications for the next round. So things are slowly getting better. Other policies that you should be aware of. You've probably heard the governor talking tough about a lot of this stuff. So last year, the legislature, much with the governor's urging, passed the Care Court legislation, which basically means that these courts can mandate care plans for people. So it's trying to get at the issue of people who are harm to themselves and others on the streets, suffering from mental illness, and us not having tools to be able to get a care plan for them. The care courts would basically create a system to mandate a care plan for them, and if they don't follow that plan, they'd go into conservatorship.
Is that institutionalizing again? Is that bringing back?
Well, if you know, the governor's brief says it's not institutions of the past,
Okay.
but it is. I mean, it
has
is
to be. I mean,
essentially, someone does lose a certain amount of their freedom as far as being able to take care of themselves.
Okay.
Sorry, I'll try to wrap this up.
Thank you.
So there's the Care Court program. There's, the governor wanted to roll out for the whole state. And all of us counties said, please no. This has not been tried before. You're not giving us any money to do that. We already have a backlog in our court system. Let us do this incrementally. Let's start with some pilot counties, right? So places like San Francisco are starting the Care Court program this year. Our county is required to do so by December 2024. Still don't have any money identified for how to do it. We're trying to learn from the other counties, but by 2024, you're going to see it rolled out here one way or another. Governor's also talking about a housing bond, a general obligation bond, so against state revenue, to build, I can't remember the exact number, I think about 10,000 new units of housing, also with a focus on veterans. And then also the governor's talking about looking at our Mental Health Services Act funds and prioritizing housing as a use for those funds, which is a challenge because we definitely rely on those funds here in the county to provide mental health services. And so as much as we want to see housing, it would be great if we had more money rather than having to take the money we already have and divide off a big chunk for housing.
The long-term policies that we see, that you've mentioned, quite a few, long-term that are happening. Long-term, we'll see buildings go up, we'll see more shelter beds, but we also need to think about the short-term policies. We need to think about right here, right now, the people on the street, right out Pogo Neck or on the downtown Santa Cruz, and short-term policies that are going to address the housing needs of those people now, because it's going to be a while for them to get somewhere else. So I just wanted to call attention to the difference.
Thank you. Okay, so we're going to have to go ahead and scrap probably a lot of our questions. So, okay, citing again the point-in time statistics, HIT, if I remember that now, okay, which references 42% not wanting government assistance, 26% thinking that they weren't eligible, and 26% turning it down or paperwork being too difficult with 25%. And again, while only 20% of the Benchlands group accepted services offered, why would people not want services offered? Are there not enough for everyone? Or are they the wrong types of services offered? Or is there another reason? So I'm gonna ask a couple of you, but again, if anyone wants to chime in, please feel free. Lisa, since you were so patient last time, you want to chime in?
I'm really happy to say I have one of our outreach workers here who could probably answer this question a lot better. But I think, no, there's not enough resources. There's not enough beds. There's just simply not enough to provide for everybody that truly needs and wants it. And why they don't accept, I think the actual number we had was closer to 30% took shelter, accepted shelter. There's a lot of reasons why they don't accept it. One, they don't have trust with the people who are offering, or they've had a traumatic experience with a healthcare provider. Our outreach workers spend months building, as Dan, I think you were talking about, building that trust that they'll accept the shelter. They've had tons of trauma in their life, and that's to just say, oh yeah, okay, I'll go up to a shelter, sounds great. And the fear of losing their belongings, the lack of community that might be up there that they don't know or trust in that building. Granted, the Armory has a lot of problems, the location for one, but nobody wants it in their backyard, right? So where do you cite a 135 bed shelter location? It doesn't happen like that. It's really, really difficult. So that's why they don't accept it. Not enough resources, and what was the other piece? Trust. Yeah, and the lack of trust.
Wrong type of services.
Are there the wrong type of service? I just don't think it's enough services. That's the thing. There just isn't enough. There's not enough resources for all of the things that these folks really, really, truly do need. But we have seen successes. I think we've housed the city 34 individuals who have moved through some of our programs, whether it's the Armory or our 1220, which is a more of a transitional housing. We've seen quite a bit of success, but it takes a long time to move from a location on the street to even get yourself prepped and ready to even get into permanent supportive housing. You've got to have something in between there. That's a really key piece, and a lot of funding needs to go that way.
Thank you so much. So we're going to start pushing along here. Bernie, would you like to add to this topic?
Well, actually, I was just going to share a story that one of our outreach workers shared with me about, and I'm sure there's more than just one of these individuals. They got the person into services, into substance abuse sort of treatment. They were living in the benchlands. And after 30 days, they walked right back down to the benchlands. What you have to remember is that we probably all know people that have substance abuse, alcoholism issues, and those most of the time don't get resolved in 30 days. And a lot of us have support systems to bring us in, to support us, to pick us up, to lift us back up, to feed us. A lot of these people don't have that. So it's the continuum of care that's not there either, right? It doesn't just happen in 30 days. So that was a really sad story, and I'm sure that they saw a lot of that, where somebody did finally choose to go to services, but in 30 days, now what? So.
Thank you.
Thank you. Danny?
Real quick, two things that I think of right off the top is having somebody with lived experience. Someone that they can trust, right? That's how you're gonna make the connection, right? Someone's gonna trust me more because of my own lived experience going out to intent and talking to them than they're gonna trust other people, right? The other piece is what he was just saying, right? Is people go into treatment for 30 days and there's nowhere for them to go after that. They're getting released from detox and residential right back to the streets. And if you have no home to go to, it's easier to go back and use. You're gonna be back in a certain community where it's not good for you, it's not safe for you. And so we don't have that continuum of care for everybody. I have tons of patients that we get them through detox and Janus, then they go to residential, and maybe if they're lucky, they get into an SLE if there's open, which is a sober living house. Now they have a new thing, recovery residency through Medi-Cal, which and only 8 beds that I think it is, and don't quote me because I don't remember the exact number, to fund for 4 months through Medi-Cal. That's only 8 people. So if somebody else can go there and they don't have no resources, you're coming off the streets or you're coming out of jail, you have nothing. No choni socks, like there's everything you got, just basic life stuff you need to figure out how to do. And all that hitting you at one time and you just barely learn some coping skills for 30 days, sometimes that goes out the window, right? And so we need to have that continuum of care. And we talk about this. I've been to so many of these meetings in the last 12 years. I'm formerly incarcerated and I came out of prison to this community, right? And since I came out of prison on parole, high control parole, I've been to every single one of these meetings, or a lot of these meetings, I should say every single one, but a lot of them, and we talk about the same things over and over, and I don't see everything getting done. Like I said, there's a lot of good things that I see are here, and that's good, but it's still, like right now, what do we need to do? There needs to be more SLEs or some kind of support where if someone don't have a job, they're homeless, and they go to this program and they get out in 30 days, they need somewhere to stay. They can't pay rent right now because they don't even got a job, right? They need somewhere to go until they can start building up that where they can get a job, get a resume. If they don't qualify for that, maybe they get Social Security. Maybe some people already have benefits, or because of their mental health, they get the mental disability, they get some kind of money coming.
Okay, so what I take out of that is you see that a sober living environment is integral to making sure that people can get out of this.
Yeah, even a transitional housing space.
Okay, thank you.
4 months.
And build on that just for a minute. Our systems of care are exiting people into homelessness every day. The jail, foster youth system, hospital. Today, someone will leave, multiple people left some system of care today into homelessness, right? So we don't have a place for people to go after they exit whatever system that is. Last year, Housing Matters and the team that we work with and our partners helped house over 300 people. Over 300 people. Year over year, we're increasing the number of people that we help move in to housing. So it can work. But all across the system, we don't have enough capacity. We don't have enough shelter beds, we don't have enough case managers, supportive services, housing navigation, landlords willing to say yes to someone who might be a little scruffy around the edges, might not have good credit history, might not want to take a Section 8 voucher. But back to this original question of why would an individual say no to shelter? So I started doing this work about 10 years ago, and I didn't understand that either. We have an empty shelter bed in our congregate shelter on a bunk bed, and a gentleman was saying no to that. I'm in pretty good shape for a 60-year-old. I can't get up to the upper bunk. I have to go to the bathroom in the middle of the night. Someone may not want to or be physically able to come into congregate shelter. Multiple people in a room. The old model was get as many people in a room as possible. We flipped the model because of COVID, saying you have to create social distance, and you've got 50 people in a room, you have to cut that below half. You have to get that down to 17 people. So we were faced with reducing shelter capacity big time or doing something different. So something different was moving all of our cars off our Coral Street campus and installing these individual sleeping cabins called pallet shelters. There were folks that we had been working with on the street who were saying no to shelter. When they saw that they could have their own door, their own 8x8 private unit, it transformed their experience, it transformed us as an organization. So the moral of this story is, it's not so much what's wrong with the individual saying no to a shelter environment, what's wrong with our shelter system, and are we right-sizing it for that individual?
Are there, just Phil, to follow up on that, are there communities that are working with that? Are there, I mean, you're talking about a pretty small number in the parking lot. What, are there communities where that's done in the hundreds? Or?
Yeah, in really big scales, and Robert knows about this, and we've been following this for a long time and watching this. So this conference I was just at, San Jose, Santa Clara County, has 500 of these, they call them temporary interim shelters or sleeping cabins, and they're on pace. They have 1,000 planned. So San Jose is really working hard, Santa Clara County, to find this interim. How do we support people, and I'm going to say this sounds like hyperbole, how do we keep people alive long enough to get them housed? So San Jose is just one really nearby example, but communities across the country are doing these, we call them pallet villages or sleeping cabins, these temporary interim, I hate to say interim housing because it's not housing, but it's this interim step, and they're using these pop-up interim small domiciles.
Thank you. If the activities in the community continue to compromise the safety of the community, this is housed and unhoused, at what point do we force the services? We sort of talked about the care court, and we talked about a couple of those, but at what point do we punish the criminal behavior? Whether that's using drugs in public, drug paraphernalia, littering, urinating, defecating, the stuff that we've all seen, the stuff that's right in our faces. When do you force the enforcement of the existing laws? And I think I'd love to have law enforcement start that, and then the services follow.
Well, I'll start off by saying that I think law enforcement is a tool to help with some of the behavior issues. Whether they're housed or unhoused, we need to enforce behavior, okay? However, we cannot enforce our way out of this problem. When we write an infraction ticket to somebody that can't pay it, it goes to civil assessment against their credit. So that actually starts negatively affecting them once they decide to make choices about housing or substance abuse treatments and those sort of things. There's also issues, as Supervisor Koenig talked to, about capacity at the jail. I'm not saying incarceration is the answer to these social issues either. But now, because most offenses, drug offenses, are misdemeanor offenses, A, the jail does not take them, B, the jail cannot keep them unless there's violence involved. I have talked to people with substance abuse issues in their past, and they say that that timeout, that 5-hour timeout into the jail did actually help some people reassess what avenue they wanted to take in life. Right now, we write them a ticket and we release them. They go right around the corner or down the street and continue with the behavior that we just cited them for. But that's Proposition 47. It turned drug offenses into misdemeanors, felonies into misdemeanors. And again, I'm not advocating for incarcerating all these folks. I'm not saying it's the answer, but it can be a tool that forces them through the court system, maybe into programs, if there was the programs. Somebody stepping in for them to maybe make a different choice for them. So I'll leave it at that. A lot of challenges around bandwidth at the jail, bandwidth at the court system, and the changes in legislation are now resulting in citations instead of arrests.
Nick, do you have anything to add to that, or yeah?
Yeah, just a couple things. I mean, as some of you may know, the war on drugs from the 80s didn't really stop our drug problem today. So we can't arrest ourselves out of this problem. And it's really not a justice system problem with a lot of these drug users. They need the services and the help that they can get. And we talk about 30 days treatment and that not being enough. It's not. And for most of them, there's something else underlying that caused the start to that substance abuse. And are we treating that underlying issue, but at the same time we're treating the substance use? Because if we don't treat that, they're gonna get out and they're gonna go right back to it, because they're trying to mask whatever that issue is. And each individual person has an individual story of how they got to where they're at, and so they have to be given the treatment in that same order. They have to get it individually to what they do. Due to a fire, obviously we don't have the sobering center in front of the jail anymore. That is on its way back, and that was that 5-hour timeout that they weren't being booked, they weren't being fingerprinted, they weren't being photographed. They were going there with members from Janus to give them services there while they're sobering up, and hopefully walking out the door and getting them to that next step. And so it's really one of those issues where we need to move people towards those resources to get them the treatment, to get them better than where they're at, and we can't arrest our way out of it.
Thank you.
I'll just be quick on this because I do think at a larger systemic level, you know, we've been hearing about Medicare for all and these kinds of things, but that access to medical care is a huge thing, because if you're not at that lower poverty level, you don't qualify for Medicare, right? And so if you do have a mental health issue or you do have chronic pain and you can't afford treatment, then people go find whatever's going to make them feel good, right? And so sometimes that's alcohol, sometimes it's cannabis, sometimes it's heroin. So, you know, so there's a variety of different things that people will take if those substances provide them some kind of medical relief. And then I guess the other thing I'll also add is that we are also in a very unique time where for about 10 to 15 years, we had pharmaceutical companies pumping people with opioids, saying that they weren't harmful, they weren't addictive, and now we're seeing the repercussions of that, because when those people got their prescriptions cut, they're gonna go find something else, and that something else is heroin, you know, and now we see fentanyl popping up. But I think we also have to really put that into context, because we did have the pharmaceutical companies creating this problem that we see before us today. They contributed to it in a major way, and we're getting a tiny little bit of money from that, because if we didn't settle with them, we could be in lawsuits with them for 40, 50 years. And so we're gonna take that little bit and do what we can with it, but we're also recovering from something that was just, you know, sadly had contributed to this major issue.
Thank you. Anything else? Anything quickly about compelling the treatment or enforcing? Then we have another question if no one wants to jump.
I can say something briefly. When you don't have enough resources available to help people and you have a policy to mandate treatment, what ends up happening, and I've been involved with this myself, is that the people who have these mandates get to jump in line for the thing. And so is that really how we want to set up a system? I think what we really need to do is have an honest look at the capacity of the resources we need to truly help people, make sure we have enough of those before we start mandating things. Because that's fundamentally the challenge that I've heard over and over again. We don't have enough places where people can sleep. We don't have enough treatment providers to help people with issues that they're struggling with. When we get there, then I think we're in a better place to talk about, okay, do we really need to mandate treatment? Most of the people I've interacted with in my career want a private place where they feel loved and supported and cared for, and if it was offered to them and available on a consistent basis, they would take it. We wouldn't need to mandate the treatment. We're just not offering that, and I think the desire to mandate is a cover for not really wanting to look at our lack of capacity.
If I have these numbers correctly, considering the $2.5 million cost associated with the benchlands cleanup or the smaller scale $60,000 cost to prevent debris from going into the waterway from the Emmeline encampment, is there an estimated hard cost calculation for these issues, whether that be associated with cleanups, policing, services, etc.? And what would an all-encompassing solution look like in contrast to that, and how would that potential cost compare? So just take it away, anybody. I do have a list of people, so Fred, you're right here.
Well, if there is such an aggregated number, I don't know that anybody here has that number on them. It is a very large number. If you're asking about how much money are we spending on cleaning up the benchlands and that kind of thing.
Right.
For the city, it's well over $250,000. But the issue around spending money on the cleanup is really indicative of what these folks are saying, which is we're spending money failing is what's happening in that. And it's a repetitious spending of money on a failing strategy in that regard. So what these folks and myself are talking about going forward are ideas about how you break that failure cycle, whether that's for the individual or frankly whether it's for the government in terms of managing our budgets. It's how do you break that cycle? And I think you've heard some very good ideas about how to do that. I think the frustration on the part of the public is that always seems 2 or 3 arms lengths away. Where is something that's happening now that I can have trust and confidence? A lot of this conversation is from the point of view of the person experiencing the homeless life and all of the complexities that go with that. And I join all of this conversation. I don't have an issue with, but I think there's also another point of view here, which is how is the rest of the community experiencing that? How are they feeling about how their money is being spent and respent, and they think it's wasteful? So in the same way that I think that the folks here on this panel are saying it oftentimes takes multiple opportunities to reach out to somebody. It needs to be the right person at the right time, and that person needs to be ready for it. I think it was Larry Imwally from the city who told me one time, and it might have been you, Phil, who told me this, that oftentimes it takes 30 or 40 contacts with the same person before they're ready. Well, I understand that. That's cold comfort to the rest of the community who says, gee, why am I having to wait that period of time till that person is ready? And I think what you see happening politically at the state level is state legislators and the governor are saying the public's sort of running out of, the compassion meter is dropping on this issue. There's I think, growing feeling in the state when I talk to other folks in other communities, and I know it's certainly true in the city of Santa Cruz. I can't speak to the rest of the county, but in the city of Santa Cruz, sadly, the compassion meter on homelessness is dropping. And if all the good things that we want to do, whether it's law enforcement or the services side and so on, the public needs to support that. And we're in this very strange time where we're really clear on what and how to do this. We need the money to be able to do the things that are being talked about here. And the public is saying, well, I'll be damned if I'm going to give you more money, because the last 2 times I gave you money and you said you were going to get this thing solved, it got worse, not better. So I think that's, you just have to deal with it. It doesn't matter whether you like or don't like that. What matters is that it's a political reality right now. And so I think that if what we can do is each do what we do really well, county governments and the state government have a long track record of doing very, very good things across the board with people who are in various kinds of distress. And that's not just the folks who are experiencing homelessness. It's all the other folks in our communities and in our state who have enormous challenges in their life. State government's actually not half bad at designing systems that the counties can implement to help out on that. And so from my point of view about this, that if we want to see success in getting bond measures passed or getting legislation passed or getting a general obligation bond at the state level passed, which doesn't raise taxes because it has first claim on the general fund, then the public better be in a place where they believe that one more vote in favor of doing that kind of thing is going to produce results. So, and I'm going to step into very dangerous territory right now.
We're really running out of time.
Yeah, well, I didn't have a lot of time. I'm going to use mine.
We're also late.
So, that is absolutely fair. But I would say this. I'm going to use the town clock as an example. Yeah, okay, that got real quiet now. You use the town clock as an example. So the town clock is there. The behavior is a good behavior. Feeding poor people who need help and don't have any other way really on a daily basis, speaking of routines, right? A routine for many people in the homeless space in the city of Santa Cruz is going to the town clock and getting fed. Now, that's good for them. I will tell you, every day when that happens, Sandy gets calls, I get calls, everybody gets calls about, well, what is that? What is going on? Why is that allowed to happen? And you go to the issue of behavior, not status. Behavior, not status. So the folks who provide that food, in my estimation, I don't have an issue with Keith. I think Keith does a good job, but Keith refuses to play by the rules. He won't get a health permit, he won't get a use permit for the city park. Well, that's fine. Then we are all of a sudden confronted with the issue of whether we have one set of rules or 2 sets of rules. Do we have one set of laws for people who are housed and another set of laws for people who aren't housed? One set of laws for people who want to provide food by law and another one if they say no. That drives the electorates to distraction. And so it doesn't matter whether you agree with me or don't agree with me on it. The political reality is the public has to believe that what we're all talking about is helping people in need who in many cases are far beyond helping themselves in their life, maybe ever. But that if we're going to do this and do it right, the public has to believe that they're going to see positive results in that, and that what they see as what we can hear this argument here, discussion about, well, that used to be a felony and now it's a misdemeanor and so on and so on. The public is so friggin' indifferent to that. That means nothing to them. What it means is somebody came up with an excuse about why something can't get better from their perspective. And so I say that what we have to do here is all of the above is what has to happen in order for the public to regain some confidence that if they're being asked to raise their taxes or do something, that they're going to see an actual result.
This idea of what does a comprehensive solution look like, and Robert here is probably the one that can really speak to the numbers, but this is sort of a pop quiz on whether or not I'm reading his staff reports. But generally speaking, it would take about $70 million over the next 10 to 12 years of investment to create enough beds and enough shelter capacity to have a meaningful impact on this issue. Today we're getting about half of that, and it's from grants that we don't know whether or not they're going to be there next year. So that fundamentally is a big part of the problem, more money. But also, once we get that money, building the housing. And there's no better example of that than the Home Key project in SoCal, which I'm sure some of you heard about, where I faced fierce opposition from the neighborhood for trying to build 37 new units of housing for people who've experienced homelessness, veterans, families, and youth. And the problem is that we have such a violent reaction to what we've seen on the streets, and we're associating the disease with the cure. The cure is housing. We have to build more housing. And even in LA, they passed a $1.2 billion housing bond, but have only built 10% of that because neighborhood groups have resisted building it. So we need money. We also need to say yes to building more housing.
Thank you so much.